We'll be starting in just a few minutes. Just a reminder that we will be recording the webinar, so please keep your cameras and microphones off. Thank you. Welcome everybody, and thank you for joining us this evening for our second Childminder webinar of the Health and Care Staff in Scotland Act 2019. Joanne, if we could have the first slide, please. While the next slide comes on, I'll just introduce myself. My name is Candice Aiken, and I joined the Safe Staffing Programme in July last year. I've been working with the ELC sector to prepare for enactment of the Health and Care Staff in Scotland Act 2019. Also supporting our sector and on the call with us today is Joanne Duncan, who is on a secondment from the inspection team and will be supporting throughout the webinar. Tonight, we will be using the online platform AHA Slides again, which allows our presentation to be interactive. If you could please scan the QR code to access the slides. This will allow you to interact with the presentation and take part in some of the polls and questions we'll be asking. Joanne will also put a link in the Q&A section for everyone who doesn't have another device or ability to use the QR code. I'll give you all a quick moment to scan the code and get organized. Joanne, when we're ready, if we could have the next slide, please. Apologies, everybody, I'm not sure. I'll just wait for the slide to be ready. Hope you've all had a really good day today and found the session very useful tonight.
That's the slide up, Candice, and people are able to access it. So we've got quite a lot of people accessing the slide just now, part in the poll. So thanks very much, everyone.
Oh, I'm so sorry. I can't see the slides have changed. So I'm just going to have to trust you and go with it today. Thank you. So people are accessing the poll. Thank you very much. So just to confirm that we are a commission program with the Scottish Government, we have data to provide that we're going to be gathering through the 2 polls. So for everybody that's already done the poll, thank you very much. But if you haven't, please answer the first poll and we'll be asking the same question at the end of tonight's presentation. I'll have the next slide, please, Joanne. Thank you. In part 1, Joanne gave us an overview of the whole Health and Care Staff in Scotland Act 2019, which will be enacted in April this year. If you've missed part 1, you can find the recording and the presentation slides on our hub page. This evening's session has been developed to dig a bit deeper into the main principles of the Act. And this session will be a little bit different from last week and very interactive. The answers are going to come from you. You are the experts, and I'm here to facilitate and guide the session. Now, I understand the pressures on the sector when there's new guidance or legislation. And I will work with you tonight to identify the strengths in your work and what you're already doing to meet the 8 main principles of the Act. We'll look at current guidance documents and frameworks which are currently available and being used to help evidence these principles. I hope you leave feeling better informed and prepared for enactment. Any questions or queries will be addressed during our Q&A session on the 3rd webinar. Next slide, please, Joanne. Thank you. Now, it's part 1A that gives the foundation of the Act and tells us about the guiding principles and why it's important within social care, which I was touched on briefly in the previous session. The Act states that the main purposes of staffing for the health and care service are to provide safe and high quality service and to ensure the best outcomes for people using the service, in our case, children. The rest of the Act is all about making these main purposes happen. Childminders should be able to discuss how they've considered the guiding principles and use them when making decisions about staffing. Staffing is referring to whether it be you on your own or if you have assistance. Next slide, please, Joanne. Thank you. In part 1B of the Act, you'll find the 8 main principles, and these must be considered when arranging your assistance and or yourself to achieve the main purposes set out in the last slide. And your inspector will look at these holistically all together and open up discussion on individual areas if needed. For the purposes of tonight's session, we will go through each principle individually to ensure there's a deeper understanding of each principle. Now, many high-performing services will be meeting the requirements of the Act, and part of this webinar is to support you to identify your strengths. Work with you and what you're already doing to meet those requirements of the Act. And then moving forward, you can use the rest of the information as a reflection on where you can make improvements. Next slide, please, Joanne. Now, we have adapted the wording for each principle to ensure that it's relatable to childminders, and these can be seen on this slide. You can see the 4th principle here, for example, is take into account the views of children and staff. We've reworded this to say, taking children's views into account and assistance if applicable. Childminders know children in their care very well, and I know you'll be considering children's views as normal practice. And as you can see, the wording now demonstrates how assistance views can also be taken into account accounts if employed. So last week, Joanne covered principles 1 and 5, and we'll now cover the other 6 principles tonight. We'll ask you to use the AHA slides to share your strengths currently in your service. Once you've contributed this to the slide, I will then share some considerations we felt the principal was already linked to with regards to the health and social care standards and the quality of framework. And they will have a direct impact on improving children's outcomes. All of the examples here are suggested. All the examples are suggested, and you may feel that there are other standards that relate to these principles. You're already working within the framework, so I'm so excited to see good examples of what you're currently doing in your practice. So without further ado, let's get started with principle number 2. Next slide, please, Joanne. So the second principle, meeting children's individual needs and enabling them to fulfill their own potential. No two individuals using your service are the same, and the outcomes that matter to individuals will vary. Childminders need to ensure a holistic, child-centered approach which involves children using the service and their responsible adult as appropriate in decisions making about their individual needs. So we're going to move on and ask you to fill in the AHA slide of good examples of how you're taking into account children's individual needs to reach their own full potential. I'll give you a moment to answer. Joanne, if you wouldn't mind reading some of the AHA slides until I can access the screen, because at the moment I cannot.
No problem.
Thank you so much.
Now, there appears to be a bit of an issue tonight with the chat function. So if people can't access the chat function, then please just put into the Q&A function and I'll be able to read them from there. So children have their own care plans. That's a great one to really focus individually on children's needs. Thanks for that. What the child likes and enjoys and giving them a choice. And that really takes some time to get to know children and identify what they like and then having opportunities available to support their next steps in progress, which is where the care plans come in. So they tie in really nicely. Ask children, absolutely. It's all about them and it's about what they need and meeting their individual needs and then what we can do to fulfill their potential with them. We've got people talking here, Candice, about observations, more listening to children, some questionnaires, talking to parents, care plans, their likes and their dislikes. Children have support in place to communicate in their own way. That's really nice. Lovely to hear a little bit more about that. If you want to tell us a little bit more about how you support that, that's a great idea. Good relationships with parents and getting to know the family. Again, so important, that partnership with parents.
And something childminders do very well, building those relationships.
Absolutely. Specific outings related to their interests as well. That's really tricky, coordinating all of that. That's why childminders are so busy, which is why we really appreciate your time this evening. Thanks so much. You managed to access these yet?
Yes, thank you so much. I don't know what happened, but I'm back on. I use picture exchange in Makaton with nonverbal children. Absolutely. Thank you very much for sharing that. And we will speak a little bit later about how you can support children that may struggle to communicate. So that's a great example. Parental involvement is so important. You know, as a childminder, you have such a close relationship with parents that you're able to capture a lot of that information. There was one there that said photos of families for the All About Me's. I love that. Individual care plans where the child is involved. Questionnaires, both for the children and parents, very important. And listen to the child. I'm wondering if there's anybody on here that has assistance and if you're using anything at the moment to get the assistants involved as well. Floor books and feedback questionnaires. And this is what I was saying, you are the experts and there's so many great examples out there, which is fantastic. Children control their own care plans and input their own information. That's wonderful to be able to be so responsive and allowing them or facilitating them to do that. I offer bilingual care, being bilingual myself, absolutely great opportunity to support the children if they've got English as additional language. See, some people are still going on to a second page, so much information. Possible lines of development are identified from floor books. Absolutely, that's how you're going to be meeting their individual needs by recording that and then planning for their individual needs. Home visits to children's homes. Wow, what a great opportunity for you to be doing that and to support the children and really building that relationship. Risk assessments, absolutely so important. And as you'll see, as we go through these 6 principles and reflecting on the 2 from last week, a lot of them interweave, and these will be covered through the other principles as well, which is great. I see a few more people typing, so I just want to make sure we're capturing everybody's voice before we move on to the next one. Evaluating your service, absolutely. Is it meeting the needs of the children? Because that changes, and you do have an ever-changing family and children's situation. So it's very important to be evaluating that and making sure that it's meeting the needs of the people that are currently using your service. Right, I'll just give it one more moment to see if anything else comes up before we move on to the next slide. I hope everyone's able to access the AHA slides. Okay, children get to visit on their own and visit and get to know me and my family before they meet the other children and enable them to feel secure. That's a great way to be meeting individual needs and building that capacity before they come into their busy environment. Thank you very much for sharing. And we'll just move on to the next slide, please, Joanne. Thank you. So this is the slide I was talking about that's sharing some examples that we thought about. So someone did mention risk assessments. If you think about in terms of risk assessments and personal planning, almost all services are already doing this and doing it well. You collect information about all your children and use this to inform and support planning. The Health and Social Care Standard 1.38, you'll already be looking at the number of children in your care, considering their individual needs and their changing needs. Consider staffing your service around children's needs and not set ratios is fundamental. So gathering all that information you said on the previous slide and considering if you're able to meet their individual needs. Now, 1.1 of the quality framework leads very well into the same point. So for example, the pace of your day and meeting the needs of children. Looking at busy times of your day, such as nursery or school pickup and drop off, as well as at the end of the day to ensure children are supported and secure while you're communicating with family members. And these are just some things that you can take away and link it to your current documentation. Thank you, Joanne. We'll move on to the next slide now. So the third principle is respecting children's dignity and rights. Children can expect to experience care which is underpinned by a human rights-based approach, where their rights are respected, protected, and fulfilled. Children are involved in decisions that affect them, informed of their rights and entitlements. How's this done in your service? I see people typing already, which is great. There are really a lot of good examples out there where childminders are respecting children's rights and supporting them to understand their rights. Privacy during nappy changing in toilets, absolutely, very important. And for maybe older children that are coming back from school and perhaps changing into casual clothes, asking their permission, absolutely. Giving them choices. Yeah, I think that's really important one to make sure that they're feeling validated and respected in the environment, that they can make choices throughout their day. The right to rest. Asking permission, privacy during toileting, absolutely. Nappy changing when they use the toilet. Respecting the decisions they make. It might not always be the most convenient for you and how that's working. And if it's not able to respect the decision, it's also important to explain to them why. Give them choices, listening to what they say, giving them time. We have the photo version of rights in our playroom and we talk about them. Oh, I love that. That's really exciting to hear. Giving older children some quiet time if they need it after school. Yeah, it can be a really hard time for some children after school, and being given that space to decompress is really important. And I can see you understand the importance of that. We have introduced a My Rights passport for the older children to help them document what's important to them with regards to their rights and linked with the Shinari too. Wow, what a great example. That sounds fantastic. Privacy during nappy changing, respecting the children's choice. Older children have responsibilities. Oh, that's lovely. So when they come in, again, you taking it back to the curriculum for excellence, for example, and giving them that, responsible citizen. I love that. And that will really build their confidence and self-esteem. Give choice, privacy at toilet time, ask permission, teaching them to have their rights. Yes, so it's easy to say they have rights, but how are you facilitating and supporting them to understand their rights? Give a reason why they must be doing something or cannot be doing something. Absolutely, it's not been done to them, but they've been taken on that journey. Giving children a choice, privacy for changing, nappy changing, and toiletry. Thank you so much. There are lots of examples coming in. I'll just give everybody a few more minutes before we move on to the next slide. Let's see what we got.
Can I just pick up on a couple of comments?
Yeah, of course.
About nappy changing and toileting, Candice? And absolutely, that's a way to respect children's dignity and make sure they uphold the dignity of children. And actually, as childminders, that is a really complex task to do. So you'll have risk assessed, leaving other children unsupervised for a short amount of time. So, give yourselves credit for the amount of work that you put into what can appear to be the obvious answer. So when you are doing nappy changing, think about the work that you put in to really support that and support the other children as well, to make sure that children can have their rights and their dignity upheld.
I think I like this.
Into what you all do.
I like this one also, sometimes reminding parents about children's rights. I think that's very important because children's rights could sometimes conflict with parents' needs, and it's important about having that communication again and that relationship to make sure that the children's rights are respected and the parents understand that as well. Encourage them to join in, but respect their right to say no. Absolutely, they don't need to join in just because you have a wonderful activity planned. It might not be what they want to do. But with the example you've got about principle number 2 and meeting their individual needs, I think a lot of you will be covering that already. Right, I think, are we okay to move on to the next slide, Joanne? Thank you. So I'm just going to pick up on some of the comments you've said. This is, respecting children's rights. It really sounds like something, and I believe as well that a lot of you are doing really, really well on a day-to-day basis. In 1.1, for example, of the Health and Social Care Standards, you are thinking about your values and the values of your setting. And that incorporates the children as well. They need to respect each other, and that comes from your value as the base. The UNCRC to 1.2 about children's rights. But how do you actively understand the children's rights and support them to understand their rights as well? Joanne's going to put a link into the Q&A section for how professionals make rights real. And this is a great resource to support you in understanding this and then supporting children to understand their rights and responsibilities. Now, one example I want to pick on, and a lot of you said, nearly all of you said, nappy changing and toileting. And we've been using this example quite a lot. And this can link to 1.1 of the quality framework. Is nappy changing, toileting, you've given the child privacy? But this can also be a nurturing time where you can support quality interaction during nappy changing, for example. In 2.1, your role is to actively encourage and support children, bringing the child's development and responsive planning into play. You can think about, do you have the right training, knowledge, and experience to support children in this area? You can consider your inclusions, equality policy, and child protection policy as well. And how do these policies impact practice? Just some reflective questions for you to take away. We'll move on to the next slide, please, Joanne. Thank you. So the fourth principle, taking children's views into account and assistance if applicable. Childminders must be able to demonstrate how the views of people who use their service and those working in the service have been gathered and how they've informed decision making. I know we're going to have some really good examples for this as well, so I'll give you all a moment to type them up. I can see there's only about 25 people on the AHA slide. If you're having a problem accessing the slides or you have something to say, please just pop it in the Q&A and we can maybe support you with that as well. I want to make sure that we get in everybody's voice who would like to share. All about me, again, the questionnaires. Yeah, you spoke a lot about the questionnaires in the first one, example. I'm sorry I didn't bring them up, but questionnaires are great. Children's questionnaires and parents' questionnaires. And then if you have assistants, get in your assistant's voice as well. From children's questionnaire feedback forms, parent and child feedback, coffee mornings with clients where you can come and join us and see what we do. That's a great inclusive way and quite informal, so you'll be able to direct a lot of that conversation. Really nice. Asking what they want for snack and activities, absolutely. How are you documenting that? Are you making that into a floor book, or do you have a flow chart? It'll be interesting to know how you're capturing that. We plan snacks together, evaluating activities, what they liked and they didn't like. That's really nice. Well done. Questionnaires for parents and children, likes, dislikes, listening to children, all about me and their feedback. Making a list of what they did on their want to do on their holidays. Yes, that's a great opportunity for maybe also including the older children. If they're going to be with you over long periods of time, it's nice to kind of plan what they can do during the day. If you have any trips, outings, biannual review questionnaires for children and parents. Change activities if children aren't happy with what we've planned for the day. Absolutely. And that brings it back to that responsive planning. Listening to children's or taking children's views into account is not always verbal. It sometimes can be through your own observations, and you can see that children aren't engaging in the activity or what you've set out, and then responding to what they are. And we've got some more photo books showing activities, asking for parental and child feedback. Children's views documented within floor books, and this is used to do mind maps for the children for future planning. Absolutely, you can see that thread there. Children involved for planning menus, outing, and choosing resources. Also using questionnaires with children and SurveyMonkey for parent and child, and evaluating the service and planning. And this is what I wanted to emphasize throughout tonight's session. These are great examples of how you're taking account the children's views and assistance in a all this great work happening out in the sector. Let children help with shopping lists for the following week. Great, so they're feeling really included. Joanne, anything jump out at you that I've missed?
Just a question of the week there. So they've now incorporated that with their parents too. So that's your self-evaluation. So that's already contributing to your quality assurance and self-evaluation. So that's a great way of doing it.
Mm-hmm. And I think that can be that's really, you can be responsive to that quite quickly instead of waiting longer periods of time. 2 stars and a wish smiley, sad faces in the floor book. I assume that's from the children to see what they've enjoyed when they reflected back on their work. Take children shopping, ask what they've planned for the weekend, and then ask how it went. Yes, that's really making them feel valued in the setting, that you're revisiting that. Weekly planning meetings with assistants. Thank you for sharing that. We've got something with assistants in there. That's lovely. So you get in their views and taking that into account with your planning. That's a great example. Using Talking Tube to find out what the interest of the child is, to start inquiries that surround their interest. The children provide feedback on the memory book, looking back on over the term, sticker points. That's a great example to use in the Talking Tube to capture their voice. But then also looking back in your memory book, so you're not just planning forward, but reviewing what you've done and what the impact has been and how the children have enjoyed it. I think we've nearly come to the end. I think one more person's typing, so I'll just give them a moment before we move on. Feel free to give me a thumbs up if this is going well, or if you feel you're understanding what we're trying to do tonight. That's everybody. Thank you. We'll just, oh, perfect. That's good to hear. All right, we'll move on to the next slide. Thanks, Joanne. So for 2.1 of the quality framework and 3.1 of the health and social care standards, you'll already be thinking about your service enabling children to have that voice, and that's evidenced in the previous slide. Think about, are you inclusive, and how do you demonstrate respect in children's voices? So there was really some good examples. And if you're not implementing any of that, that's absolutely fine. But this is your opportunity to look what's been happening in the sector and use that moving forward. 3.1 also talks about a shared vision that reflects aspirations of the children and families. And you gathering that through your self-evaluations, through your questionnaires and your feedback sheets. So how, childminder, are you creating conditions where where all people, including staff, feel confident to influence change. And through the examples we've just seen, that's already been answered. In the Health and Social Care Standards 2.11, it states, my views will always be sought and my choices respected, including when I have reduced capacity to fully make my own decisions. And this is something I spoke about when someone mentioned Makaton. You can also look at realizing the ambition, and there are other tools out there to support children who may struggle to communicate or to be heard. Not everybody's confident to speak in a group. So giving maybe a shyer child the opportunity for a little one-to-one session or to draw are some examples. How are you and your assistant, if appropriate, reflecting on the skills needed for these quality interactions? Like I said, gathering children's voice is not always verbal. It's using other skills to gain their voice. And also think about, do you have the time and capacity to support and place value on these interactions? You'll be demonstrating through self-evaluation procedures how you listen to and consider children's views. So these are just some examples that you might think about going away. We'll move the next slide, please, Joanne. Thank you. So as you can see, we're going straight to number 6, as number 5 was covered last week. And this is about open communication with children about decisions on their care arrangements and assistance if applicable, as well as taking into account the views of those working in and using care services. Childminders must be open to those individuals making decisions on staffing. In your service, you should foster the development of an open culture that allows and encourages those who work with you, if appropriate, in your service to raise issues. When we talk about staffing, this could be your own staffing needs as well as a sole provider. So let's see some examples of open communication with children about decisions on their care arrangements. I'm just being quiet so everybody can have a think about that. See a few people typing away there. And this could be on a day-to-day basis, on a weekly basis. If you have events coming up, you can think about how you communicating with the children. Contract settling in, so upfront you're discussing that with the families about how you arrange yourself, what your ratios are. Some parents that might be joining your service, that's a good example, not know what a childminder's ratios are. Children's questionnaires, again, using children's questionnaires to capture their voice, listening to them. If parents will be letting them know if parents will be late, absolutely. Again, just keeping them involved so they're not feeling worried or stressed. Reviewing care plans regularly, additional support and care needs if needed in care plans, yes.
And what about for new children starting? That will have an impact on the care arrangements of the children already in your care. So
Absolutely.
How do you communicate with children already in your care if you have another child starting or you're going to a new nursery to do a new pickup? So how do you make those communications when you are going through the contracts of settling in? How do you settle in the children already in your care?
Involve children in rights and policies. Wow, that's really inclusive. See a few people writing through care plans and child parent questionnaires, involved questionnaires, all about me. Open discussion with children about changes, absolutely, any changes. And that could be if they you needing to go to a different area to pick up a child, or if plans have changed, and keeping parents involved in that as well. So that open communication with children, but with the families as well. Letting children know that a wee one will be starting, sending out WhatsApp messages to parents, absolutely, because a family could arrive to collect their child and see a new face. And that would also be if you then got an assistant and they're going to be around, and how you go about introducing that person to the children and the families so that they're all included. Someone said they use newsletters to introduce a new child, and that's very nice for the child to see themselves being included in the newsletter. Children know who's dropping off and collecting them, especially if there have been a lot of people caring for them. Yes, some children have a shared placement, and that can be disruptive. So keep letting them know who's coming to get them. Lots of settling in visits, pictures of children displayed so that they know who they're settling in. I discuss any requests for new care with my assistant to ensure she is happy and we can meet our ratios. That's really inclusive and so important that you're taking the time to consider your experience and your ability to cope before you bring somebody else in. That's a great example. Thank you for sharing. Communicating changes with children. Children like and make cards for new children settling in. Oh, what a great welcoming way to include new children. Prepare children for pickup time and welcome days for new children. Absolutely. Just there's something that says about a transition policy for children. I can just see the top part of that. Thank you, Joanne. We do visits to new settings as a group, as a transition policy for children. Oh, that's great, getting everybody involved in it. Prepare children for next steps at nursery, settling in. So you're speaking about that shared place and working with the nursery or the school. Keep children and parents informed about any changes. Absolutely. A few children have been experiencing emotional stresses following COVID, so we have a time dedicated to chatting around the dinner table to allow us to express ourselves, share stories about their day. Also, children know that they can come to have quiet chats if anything is upsetting or bothering them rather than holding it all in. What a wonderful way to support children's emotional development. And this is the great work that childminders are able to do in your home environment. Discuss with children as to who the new child will be and how they might feel about this. Yes, because it can be disruptive for new children, bringing a new body into their system, and that might be upsetting for the child settling in, but also for your current children as well. It's really inclusive to be thinking about that. We visit schools on our walks in the summer holidays to prepare for transition. Absolutely, that's wonderful. Getting them ready for that transition to school or to nursery is so important. Encouraging social interaction. Right, we'll just give it one more moment before we move on to the next slide. See if anything else pops up before we move on.
I just think this is all so fantastic, Candice, isn't it? Really,
So
I mean,
good.
that about welcoming children and children making cards for new children when they start. Do you know, I'm sure that's probably part of your policy that you reflect on, and it's just such great practice that we need to be shouting more about the great work within childminding services, because look at all the great stuff that you'll do. It's so fantastic.
Absolutely. And I've just read this one. If I'm having a variation for extra preschoolers, I consider ratios and whether I can still offer school pickups, etc., or just focus on preschoolers to provide the best outcomes and discuss this with all the children. That's really opening that two-way dialogue, considering the children's individual needs. Like I said, these principles are interwoven. So again, you're bringing into individual children's needs and your ability to manage before making those changes. Thank you. Those wonderful examples there. We'll just move on to the next slide. So the Health and Social Care Standards 4.15 for childminders, this is about talking to children. Again, you've expressed that in the previous slide, and explaining to them about their day. So for example, telling them that it's nursery time in 30 minutes. And if you have an assistant, informing them of who will be collecting them on that day. And someone took it even further if there's multiple people picking them up. So really being explicit with children so they feel involved in what's happening in their care. Also explaining to them that, for example, after nursery, we're going to the supermarket to buy some food for lunch, for example. One could consider visual aids for children to help them keep informed, a visual schedule to keep them to communicate about their day. And it's just a nice way to keep them focused and involved in what's happening in their lives and in their care. Thank you, Joanne. We'll move on to the next slide. So we're moving on to number 7 now. Recognizing what I can accomplish as a sole provider and managing my time and assistance if applicable. On the previous slide, someone did mention about that, speaking to the assistants before inviting new children, about involving children and your ability to cope with that change. So we'll see what people have to share about this one. Listening to everybody's input gets me really excited about the wonderful care that the childminders are providing for the children out there. It's really exciting. And I hope you can see, as I've reiterated throughout today, is that you do have the answers. You are able to meet the requirements of this Act. If you need to change things or improve things, that's absolutely wonderful. But a lot of this core foundation is happening already. Just give everyone a moment to join in. You can maybe think about how do you split your assistance and your time effectively as well if you do have assistance. Being able to say no, even when you could take a child absolutely within your numbers, so important. And I do understand this is your business and that does affect your income. I just want to touch quickly while everybody's typing. Principle 5 last week was ensuring your well-being. And I think this relates to it very well. You know, what can you do within your capacity to ensure the best outcomes for children, but also to support your own well-being? And being able to say no, even if you're in your numbers, to improve those outcomes for children and support your well-being. I'm able to give each child one-to-one attention. Being realistic about what you can achieve within your timeframes, absolutely. And I think most people that work in the care service and childminders, we want to be helpful, we want to be kind, but sometimes you have to be realistic about what you can do and say no when you can't. Recognizing that it may not be a good fit to include a new child, absolutely, as it can take time away from the other children, absolutely. And do you have the ability to manage that? The relationships are so important as a childminder, so that's a very relevant point. Have an effective planning. Spread paperwork over the years so I don't feel overwhelmed, absolutely. Children are included in activities such as walking the dog. I can work to a fantastic standard, say no, as no manager can give me more work than I can cope with. Absolutely, you're in charge of this. And this is all relating really well to taking charge of that well-being, not feeling overwhelmed and stressed. I can choose my working hours so that I can still enjoy my job. Absolutely. You don't want to get to the point where it just becomes a monotonous day. You want to be enjoying your time with the children. Understanding each child's needs and knowing that you can help them reach their potential. And if you're struggling, speak with other childminders that will help and support. The childminding networks are invaluable. Being able to rely on other childminders on a day-to-day basis, or if you're struggling with something, if you're needing some support, please rely on the childminding networks that are out there. Planning children one-to-one, giving children one-to-one, look after your own well-being, decide how many mindies you want on a day-to-day, and don't be afraid to say no. It sounds like you really have a good understanding of recognizing what you can accomplish. Having self-improvement quality calendar to spread out the paperwork, absolutely, and that's so important. If you have it written down, if you have it planned, you're not going to forget it, but it's making sure your job is manageable. It's not realistic to do the paperwork during the working hours, and then you have to block off time during the weekend, or only working 4 days and keep one for paperwork. It's a shame that we're not paid for this, but it has to be taken into account, absolutely. Still have time for my family, which is the main reason I started childminding. And, you know, that is the beauty about childminding, is you have the flexibility to manage your own hours of how many children you're going to take in. So it can be quite empowering, learn to say no. Spirit training, yep, you got your paperwork, your training throughout the year. My assistants and I play to our strengths and interests. Absolutely, I'm so glad you brought this up. My assistant, for example, is sporty and enjoys technology, so the children will do these things with her. Meantime, I can do arts and crafts, baking. It's so important to identify what your strengths are, and if you have an assistant, play to their strengths as well to ensure that you're getting the best opportunities for the children in your care. We plan different interests into our work week. That's wonderful. Knowing my limits, time out for my own family, stop, pause, and think about the answer before you answer to parents. That might not be good for you. Absolutely, you really seem to be grasping that understanding, and that all brings back to looking after your own well-being. Joanne, anything jumps out at you before we move on to the next slide?
Just a couple of people mentioning about paperwork, and I just want to reiterate that please don't start doing any more paperwork for this legislation. That's absolutely not necessary. No. You will already have policies and procedures in place. I can see a lot of people talking about floor books, questionnaires. Just write on whichever ones are relevant Health and Care Staff in Scotland Act, or if you'd rather write down the principal number in the corner to show that it relates to that, and then you'll be able to talk to your inspector about it. We don't need to see more actual evidence if you can talk about it. So I link your policies to the principal numbers here so that you'll be able to talk about it and just continue to build your knowledge on what the principles relate to that you already do.
Absolutely. Thank you for sharing that, Joanne. That's great. We'll just move on to the next slide then. So talking about evaluation, so in 3.15 and 3.17 of the standards, you'll be looking at your numbers, what is expected of you in the day and what your needs of the children attending your service. So there's lots of great examples on the previous slide that cover that 3.15 and 3.17. If you're working with a child who has additional support needs, consider your numbers. So if you have 6 children, 3 under school age, are you able to support the children effectively? And what is the impact on the other children in your care? And what are you able to accomplish on your own? So I think that was very evident. You definitely understand that from the previous slide. Now in the quality framework 1.5, you can consider effective transitions. Consider school and nursery pickups. For example, some childminders do multiple school pickups, and if the children are sitting in the school office, ask yourself, is this providing a safe and high quality environment or improving the children's outcomes? And is it within your scope to be doing this? This principle, when done well, has a great impact on your well-being and that of your assistants, as I spoke about. Thank you, Joanne. We'll move on to the last one. Thank you. So building relationships and working with other agencies to support children and families in your care. Childminders should promote a multidisciplinary approach where it's appropriate to meet the needs of children using your services. Does anyone have any examples of how they are building these relationships with other professionals? I see a few people typing this. So I'll just give them a moment. So when I say multidisciplinary, it could be any other professionals. And how are you building these relationships? It could be health visitor, speech and language, or even the nursery staff and school staff that you see at drop-off and pickup time. Do we have any community childminders on tonight? Get to know the children's key worker at nursery. Absolutely. They're going to be seeing you on a regular basis, so building that relationship. Blended care with nurseries and professional discussion on child's development. The nursery will see a very different side to the child than what you see. So having those communications is very important to be supporting their outcomes. Working closely with other childminders and nursery and school staff. Joint learning journals with the ELC. Wow, that's really interesting and really inclusive if you're able to do that. Partnership with your local authority, absolutely. Whether you're in partnership or not, you building up those relationships, but as a partner provider, you're able to support the child and build up those relationships. Using learning journals, which the nursery can access, keep open dialogue going with the nursery, absolutely. Keeping that communication, really good example there. Close contact with school for the school-age children. Contact with class teacher, ASN, is essential. Absolutely. Keep an open dialogue with nursery staff. For a lot of these children, you'll be the face that these other professionals are seeing on a regular basis. So keeping that dialogue and then also helping to support their communication back to the parents as well at the end of the day. See somebody else writing, so I'll just wait a moment. Going into other local nursery settings to spend time in larger settings for mindies who only attend childminders for funded hours. Absolutely. Contact with forwarding school invite to transition visits. Absolutely. And, once you have those positive relationships with the other professionals, you will be open to a lot more opportunities to support the children in those transitions. We spoke a little bit about your childminder networks, and play groups might be a good example for helping build up those relationships with other childminders. Learning support visits for stage intervention. Wow, to be involved in that, I hope that's a good opportunity for you. Work with the council, attend toddler groups, absolutely. Some really good examples coming up here. Joanne, anything jumping out at you that you'd like to share?
Just thinking about that importance with your other childminding colleagues. You know, you can support each other with perhaps next steps for children, thinking about child development. So there's a couple of people spoken about working closely with other childminders, and that is really important to support children and families, to see what other support is available in the local community. You know, if you want to be directing families to any support that they may need themselves, you can ask your childminding colleagues about services that they might be aware of in the local community. Somebody's invited to the TAC meeting there.
Yep. I've been a member of the Scottish Childminding Association. Absolutely, what a great resource. They provide a lot of professional opportunities for learning and training. That's a great example. So we'll just move on to the next slide, please, Joanne. So I spoke about some examples. You could be working with health visitors, doing home visits with health visitors. If a child has a speech and language or attending speech and language, are you able to get some support, how you can support the child while they're in your setting, for example? And then I mentioned briefly community childminders. They often work with a range of professionals to support children's outcomes. And these supports could be long or short term, so it's depending on the needs for the children and the families. Looking at the 5 getting it right questions from GERFIC is a good place to start as well. Now, if you haven't come across this, Joanne will put a link in the Q&A section, and that you can maybe go and investigate a little bit more information about that. Although there has been lots of good examples of GERFIC and Shonari throughout tonight's session. So now we've come to the end of our additional 6 main principles. So by answering these questions we've asked during the sessions and through your own quality assurance processes, you'll already be evidencing a lot of the requirements set out in the Act, and I hope you can feel that. Moving forward, you can look at your policies and procedures and processes, reflect on your service to ensure that you have the right people in the right place with the right skills at the right time. And think about what you can improve upon to ensure that you're meeting the expectations set out in the Act. I hope all this is demonstrating that this legislation is not seeking any new or innovative models of delivering your service, and that you may already have measures in place that would support you. Like Joanne said, link it to current evidence and documentation. Don't go out trying new things. We'll move on to the next slide, please, Joanne. Thank you. So there is statutory guidance that accompanies the Act. The guidance is still in draft form. However, consultation is closed and the final revisions are being made by the Scottish Government. On our hub page, we have linked each principle to the statutory guidance, along with documents that you might want to consider to meet the relevant principle. You can find this when you go into our ELC Safe Staffing hub page. And under the Childminders tab, you will see the 8 principles. And you can click on the hyperlink and it'll open up into a PDF. Joanne will pop a direct link to our ELC Hub if you haven't visited in the Q&A section. This is a great opportunity for you to go through when you get a chance. You can see it click on each of them, and this is the PDF that will open up to support your own learning. Thank you, Joanne. We'll move on to the next slide, please. So thank you for everyone that answered the first poll. I would be very grateful if you could support us again with our data gathering and answer this poll to identify if you feel that you're any more familiar with the expectations of the Act. Thank you. I'll give you all just a quick moment to answer that. Thank you very much. Like I said, we are commissioned by the Scottish Government, so it just helps validate that the work we're doing in the sector is making that impact. And a thumbs up. Thank you very much. I really appreciate that. Oh, wonderful. Thank you. So we'll just move on to the last slide then, Joanne. So thank you very much for attending our second session this evening. On Wednesday, the 7th of February, we'll be hosting just a Q&A session from 6:30 to 7. If you would like to join us, that will be great. The QR code on the screen will take you to a Microsoft form, which invites you to submit any questions or queries you might have about the Act. So with the high numbers registered for each event, we didn't feel that we had the time for a Q&A session at the end of each. So we will review all the questions submitted through the form. We'll then provide a response and support any further queries at the end of the Q&A session. You'll also be more than welcome to come off mic next week and ask specific questions during the Q&A section. If you haven't signed up for the session yet, we'll put a link in the chat now for you to register. Joanne, any closing comments before we finish off tonight?
Well, just to thank everybody for taking part and joining us tonight, and it was great to see so many people feel that they are completely ready, and with all the great evidence that you've shown tonight, I could absolutely agree with that. So thanks very much for contributions. It's been great to see them all.
Yeah, we always enjoy engaging with the childminders. So thank you for giving up a little bit of time of your evening. We finished 9 minutes early, so that means you get 9 minutes back tonight. And we look forward to speaking with you next week.